Hi, I'm Kirti, and welcome to my presentation for research on decoding lung cancer, a global data story on survival and risk factors. Today, I'm going to talk about how data driven storytelling reveals really determines lung cancer survival across the globe. Lung cancer is a leading cause of cancer related deaths globally. Over 1.8 million people lost their lives in 2022, with 2.5 million new diagnoses. It contributes to nearly 18% of all cancer deaths, making it a major public health concern. In this research, I explored what are the factors influencing lung cancer mortality and survival across top 5 countries. We dive into 5 sub questions examining the impact of smoking, environmental exposure, cancer stages and insurance, healthcare access, and survival rates across nation. Let's explore what the data reveals. In the first screen, we get to know about the how smoking status affects mortality risk rate in lung cancer patients. Here, there are three types of smoking categories: former smokers, non smokers, and smokers. According to this KPI, we get to know that former smoker contributes highest with 33.41% on overall mortality risk rates in lung cancer patients. In this table, we get to know that average age of 60 years affects mortality risk across top 5 countries, that is Japan, Myanmar, South Africa, South Korea, and Thailand. To explore more, we will see how just smokers can affect mortality risk rate. Here, we can see that if only smokers are considered as category for affecting mortality risk, then Thailand and South Korea effects have the highest mortality risk rate. Thailand provides us with 20.39% with a count of 1093, followed by second highest country, that is South Korea, which is 20.28% with a count of 1087. This states that how the data enforces that smoking remains a dominant force in lung cancer outcome, not just for active smokers but also for the former smokers in all 5 top countries. Let's see how next factor affects mortality risk rate. Here, we are talking about all the few environmental factors like air pollution and occupation exposure. Here, we have categorized it with two different visuals. The first visuals talk about how air pollution is affecting mortality risk. In this, we get to know that air pollution with low has the highest mortality risk of 50%. Whereas, if we talk about just the occupation exposure which doesn't have occupation exposure has highest mortality risk of 49.97%. We also combined air pollution and occupation exposure together to see how does it affect according to the combination of both the environmental exposures. Here we can see that occupation exposure has the highest mortality risk with air pollution of total 50.13%. Now, let's see how rural and urban areas are affected by air pollution. Here, we get to know that rural areas with low air pollution affects mortality risk by 50.110%. Also, comparatively with urban area with low air pollution has the highest mortality risk rate. This suggests a complex interplay. Urban population and pollution, indoor air quality, and occupation exposure may be slightly driving up cancer risk despite officially low population and pollution levels. Let's see how cancer stages and insurance affect mortality risk rate. Here, if we observe that stage 3 and 4 has the lowest and highest mortality risk rate. Stage 3 has the highest mortality average risk rate of 50%, and stage 4 has the lowest mortality risk of 49.73%. Let's see how insurance covers affect cancer stages and its mortality risk rate. From this second table, we can say that stage 1 and stage 4 has the count of mortality risk rate including insurance covered under it, which is approximately count of 13,000, whereas stage 2 and stage 3 has around 20k percent of the total insurance coverage with mortality risk rate. Overall, insurance covered for all the stages is 70%. Rural areas has Rural areas and urban areas should have a compulsory situations where they can have insurance coverage for all their people that can cover all stages. Despite of this, this proves that interestingly 70.06% of patients have insurance covered across the stages. But even if the insurance is covered in the later of stage 2 and stage 3 has the highest survival and mortality risk rate, indicating early diagnosis is far more impactful and important than just for insurance coverage. Let's see how health factors and healthcare access affect survival outcome. We can see that this section clearly indicates how healthcare access shapes mortality and survival outcome. Here we can see that if the delay in diagnosis happens, then the survival probability is less with 27,000. But if there are no delays, then the survival rates are probably increasing with 60 with a count of 65,000 approximately. Let's see how the survival count with healthcare access differs in different types of healthcare access in rural and urban areas. Here we can see that good healthcare access in urban areas has highest survival rate of 32,000 approximately, whereas poor healthcare access has in rural areas has around 6,000 counts of survival rates approximately. But if we check in the total healthcare access survival count, good healthcare access has around 46,000 survival counts, with lowest for poor healthcare access, which is 18,000. Limited access health has survival of 19,000 in urban areas and rural areas with 8,000. Despite this proves that investments in early detection and infrastructure accessibilities health is vital for healthcare access and survival rates. Let's see how the top 5 companies and 5 countries affect the mortality and survival rates overall. This tells us that South Korea and South Africa has the highest survival rates. South Korea has the count of 3,256 and South Africa has 3,255. This indicates effective national programs, early screening, or perhaps cultural and policy factors that promotes faster response and treatment accesses. Let's see how key findings and data-driven insights can help us for this research. Let me summarize the 5 major takeaways from the visuals analysis. Smoking status strongly correlates with mortality. Even former smoker remains at risk. Urban environmental exposure, not just pollution level, plays an important role. Advanced cancer stage have higher mortality and insurance keeps only when diagnosis is early. Healthcare access, especially in rural zones, significantly affects survival probabilities. Countries with better screening programs and early access shows higher 5-year survival rates. Together, these findings stress the urgent need for a proactive, equitable, and technological driven response to lung cancer. Let's see what recommendations we can give to the business. Investment in anti smoking campaigns. Enterprises can launch internal wellness programs, offer nicotine replacement therapies, and fund anti smoking drives. This will reduce risk at the workforce level and beyond, promote healthcare and clean air policies, collaborate with urban planners to monitor air quality, conduct workplace audits for air filtration and exposure, recognize and reward green companies with tangible health impacts. We can also expand our diagnosis with insurance and build a diagnostic tool using AI for a better uh, survival rates count. For moving ahead, to conclude what the data tells us, this research leaves no doubt. Data confirms that survival from lung cancer is not random. It's deeply tied to smoking behavior, environmental conditions, timely diagnosis, and healthcare access. By corresponding to these insights with business innovation and targeted public policy, we can tilt the survival odds in humanity for flavor. By integrating data driven intelligence with actionable insights, this report offers a holistic view that supports statistic and statistical improvements in global lung cancer management and survival rates. Thank you for watching this research presentation. If you're a part of healthcare policy, insurance, or business community, your action matters. Let's not just analyze survival statistics, let's improve them. I, Kirti Savai, has been a data this and this has been my data driven journey into lung cancer survival. Stay informed, stay responsible. Thank you.